Hello, everyone, and thank you for attending the Vista Health Virtual Job Fair event. I would like to introduce you to Julianne. Julianne will tell you about her company, job openings, and how to apply for those openings. Julianne?
Hi, thank you. Thank you for having me here today. Welcome to the virtual job fair for Vista Health System. My name is Julianne Nagel, and I am the talent acquisition specialist here at Vista Health System. I do all the recruiting for most of the clinical positions in the hospital, as well as some other various leadership positions. I do have a co-recruiter. Her name is Robin. She is not with me on the call today, but she does recruiting for a lot of the allied health professions and some other clinical positions that we can kind of talk about as well. But first, let's kind of start with a little bit about Vista Health System, who we are. We have been in Northern Lake County for many, many decades. We have a lot of history here in the community of Waukegan. So we really became Vista Health System back in 2000. We had two main hospitals here in Waukegan. They kind of merged together, and that's when our name kind of became Vista Health System. Kind of fast forward to today, our system is consists of the main hospital here in Waukegan off of Glen Flora and Sheridan Road. That is 228 licensed beds, community hospital. We have full service here. We have pretty much all, units and service lines in a hospital. And we're a level 2 trauma. We do all our surgical services here. We have a lovely mother-baby unit. We have a lot of our laboratory diagnostics, pharmacy, all of those services are also here on site. And we're primarily here to service the patients that kind of live around the surrounding communities of Waukegan, North Chicago, Beach Park. We go all the way up to Winthrop Harbor. We see a lot of patients from Wakanda, Gurnee, Grays Lake, those areas as well. Our second campus that we have is in Lindenhurst, Illinois, off of Grand Avenue. It's about 15 miles west of the main hospital, and that consists of Lindenhurst Day Surgery. We have a freestanding ER over there, and then we do have a medical office building. We lease some of the space, and then we do have a physician clinic in there. And then we also have other physician clinics throughout Lake County. We go as far west as Round Lake Beach. We have clinics in Grays Lake, Lindenhurst, several in Gurnee, Waukegan, and also Zion, Illinois. So that's a little bit about what our system, the different locations. We also do have like an MRI institute. We have a few other smaller locations with some services, but we're very active here in the community. I've been here a long time, and we're really about helping our patients that need our help here in the community. The positions that we are hiring for are pretty much, mostly all related to the medical field in healthcare. We, hire anything from a registered nurse in the state of Illinois here. We hire a lot of CNAs, certified nursing assistant, which Vista calls them patient care techs. So if you see postings for PCT, that is equivalent to a certified nursing assistant. We have ER techs that work out of our ER and kind of assist our nurses with kind of more of that trauma. We have monitor techs that kind of are similar to an EKG tech. We hire OB techs. We hire a lot of respiratory techs, surgical techs, cath lab techs. So we draw a lot of positions here at the hospital that are technicians. Most of the positions do require some sort of medical certification or license to work in some of these positions, or some of the basic qualification to be considered for employment. And all of our job just, postings will include that. If you go to our website, or sometimes we post on Indeed, all of that will be under the qualifications. So kind of going back again, so there are a lot of different opportunities here at Vista Health if you have an interest in the medical field and healthcare. A lot of our candidates, go to some of the surrounding schools, work with some of the local colleges, or go through diploma certification programs for a lot of the positions here. There are other positions that do not require a license or certification. That would be medical receptionists. We occasionally need, patient transporters. We may be looking for more administrative positions that work in the hospital. Currently, we're pretty staffed on those positions, but from time to time, we definitely have a need for those, and they would be posted on our website when we have those openings. So I wanted to kind of just circle back to some of the positions that we are actively interviewing today. We're in the beginning of November 2020. We are at we're all at difficult crossroads with the pandemic. So there are some positions that we are definitely in need to kind of help us through some of these tough times. Kind of going back to the patient care tech, which again is the equivalent to a CNA. We are definitely in need of hiring patient care techs. These individuals are really there to assist the nurses on the units. They would be working on our medical surge units, our tele units, our ICU units, really, just helping our patients with day-to-day activities while they're admitted here in the hospital. And those positions are all 12-hour shifts. So we are looking for both part-time and full-time. A part-time position would be 24 hours a week. That's 2 12-hour shifts. And if you're interested in a full-time position, it's 3 12-hour shifts, and that's 36 hours a week. So as I said, we are looking for either people to work on the day shift, which is 7 a.m. to 7:30 p.m., or if you're a night person, we do have shifts that are 7 p.m. till 7:30 a.m. And both benefits are offered for part-time and full-time, and we'll get a little bit, talk a little bit about the benefits towards the end. But again, those positions are part-time or full-time, and they do come with benefits. I would say our starting wage for that position is probably going to be around $14.15, $14.15. We look at years of experience. So we kind of, that's just our starting wage, and we kind of go up based on an individual's experience as a CNA. Another position that's similar to our patient care techs is our ER techs. They specifically work in the ER and the trauma centers assisting the nurses. We have a lot of candidates that come with an EMT background. They come with, they work for ambulance service, companies. They sometimes work in fire departments as a paramedic. We also take, a certified nursing assistant. Or we will look at a nursing student who is maybe has completed their first year of nursing school. So those are some of the kind of backgrounds that maybe an ER tech position, we're used to seeing a lot of that, on their history, their employment history. So an ER tech is very similar to the patient care tech, where it's 12-hour shifts. We have full-time and part-time, and again, we have days and night shifts. I will tell you the starting wage for an ER tech is very similar. It's, $14.15. And then again, we look at years of experience. Now, both of those positions are always a great position for those who are in nursing school. We have a lot of students in nursing school who are looking to join us and get their experience, start working in clinical units, kind of helps them with their schooling, even kind of connecting the dots. So those are two great positions that if you're a nursing student or somebody who's thinking about going into that, those are some great jobs to start at. We're also looking for registered nurses. So those who either have an associate degree from a nursing program or a bachelor's degree from a nursing program. We have both full-time and part-time positions for nursing. And those are also the same kind of shifts, 12-hour shifts. We have days and we have nights. I will tell you that our nursing positions for starting wages, if you are a nurse with an associate's degree, we start you at $28 an hour. If you come from a bachelor's program, then it's $29. Those positions are all benefited, come with benefits, and there's also some great shift differentials. For the nursing program, you have a potential to make a lot more in a shift if you're working on the night shift. We do have shift differentials for both the PCTs and the ER techs as well. So again, if you're working a night shift, there's you have some potential to make a little extra money. And then anytime anyone works on a weekend, we have like a weekend shift differential rate as well. So lots of different ways to kind of earn a little bit more money, depending on your flexibility and the schedule that you're looking for. So I will tell you that today, those three positions are actively being sourced and recruited for: patient care techs, ER techs, registered nurses. We do have some other one-off positions we're looking to hire. I don't have a lot of these positions, but I am looking for monitor techs, and those are kind of like an EKG tech. They're really monitoring all the monitors that our patients are hooked up to. We are looking for an OB tech. An OB tech would be working with our, in our labor delivery OB unit. An OB tech usually comes from, we look for somebody with experience from kind of the surgical areas. So they may have some experience being a scrub tech in various different surgeries, or possibly in just, in labor delivery kind of, experience. That is a little bit more specialized, and it does require, we typically like somebody to have that surgical tech, surgical background. However, we will consider like a CNA or an ER tech if that's something they're passionate about, and that's, they're trying to get into that position. Depending on their experience and how they interview and all that, they can be considered for that position as well. We would just have some additional training to do. So those are a lot of the positions, again, that we're really looking for right now. We do, of course, hire lots of other positions throughout. At any given time, we may have a pharmacy tech position available. We may have a medical technologist, a med tech. Let's see, a few other positions that come up. A phlebotomist position. We may look for a respiratory therapist, or sometimes there's an ultrasound tech that's needed. Those are always positions that if we do have the opening, it would be on our website. You can go to our website at www.vistahealth.com. And all our positions that are open will be posted under the employment tab. If you click on the employment tab, you can kind of see a lot of the different positions that we have. I think right now it's pretty up to date and accurate with some of the needs that we're looking for. So let's kind of talk a little bit about benefits. So if you work at Vista Health System, what kind of benefits would you get? I think that we have a great benefit program. We've got lots of options to choose from, but what's so great is a lot of organizations don't always offer benefits for their part-time employees. We do have employees that are part-time and they enroll in our benefits. We have 2 different medical plans to pick from. We offer vision and dental benefits. Again, they're all optional. We also have prescription drug coverage that comes with the medical plans. We have flexible spending accounts for both, for items that are related to healthcare expenses or the dependent care flexible spending account. So it's pre-tax payment for dependent expenses that you may need. We offer a lot of different life and disability insurance, as well as supplemental life insurance for family members. We have identity theft programs. And we also, I think is a big thing, we offer tuition reimbursement. So tuition assistance for those individuals who are going back to school or continuing their education. We've got some great plans on there. Just to give you an idea, if you're interested in nursing and you work here full time, you can get up to $5,000 in a calendar year towards that education assistance. If you're full-time and you're working on a different program, or maybe it's a different health program, it's $2,500 per calendar year. So I think that's a good benefit to mention. And then we also do have a 401k program that you can enroll in. And our employees, both again, part-time and full-time, will get paid time off and sick time. They are two separate banks that we offer our employees. Some of our positions, we call them per diem or PRN. A lot of healthcare organizations hire individuals that they may get paid a little bit higher wages, but they don't participate in our benefit programs. But the luxury kind of with that position is it works very well with people who have, they don't maybe have a lot of availability to give and work. So it's very flexible for those who can maybe only give a few shifts in a month, let's say. So again, that's pretty popular with nursing students. They're always kind of juggling their school, their classes, their clinicals. They also want the experience. So they come in, they work a few shifts a week, or I should say a few shifts over a month, really. And the benefit of that is, again, they get paid a little bit more. They do not get benefits, but it's kind of a win-win for everybody. It helps the hospital able to staff sometimes hard shifts to get coverage, that sort of thing. But it allows a student to enroll and start getting some of that experience and make a little money also. Those PRN positions, we call them PRN, or again, per diem. We put those on our website as well, if that's something you're interested in. One thing I would mention with those PRN positions is if the hospital has low census, or maybe there's just a shift that's not needed that day, they are typically the first employees that would be low census called off to kind of go home if we just don't need them for the day. So part of that flexibility is a candidate being okay with not, if they get called off, they're okay with that. So those are some other positions that we may be looking for right now, and that would primarily be in the patient care tech, again, position. So I think I've kind of covered, hopefully gave you a good introduction on Vista Health System and who we are here in Northern Lake County, and some of the key positions that we're looking for today. Again, a patient care tech, ER techs, and registered nurses are kind of the big, the top three that we are actively recruiting and sourcing. You could go to the website, look at those positions, and apply. If you don't see the position or a shift that you are looking for, I still recommend you apply. As a recruiter, a lot of times we talk to candidates, and sometimes we may find a fit for you, or things change a lot in healthcare. So by the time you applied, and I may be able to connect with you, we may have a position you're looking for open. As far as our interviewing process, we're doing right now, we are probably going to switch back over to a lot of things that are over the phone or virtual. We had a COVID surge here in the early spring. We've been doing pretty good for the last few months, but we are starting to see the surge that everybody else is seeing. So we are going to move to a lot more phone interviews and virtual interviews. But typically you start with one of the recruiters kind of in a phone screen. Then if you kind of move on the process, as recruiters, we share resumes and the phone screen information with the managers, the hiring managers. If they are interested in moving forward in the process, then usually the recruiter is reaching back out to you and setting up, what would be the next phone interview with a manager. Sometimes it might be with one or two different managers, and occasionally a third interview may be scheduled depending on the unit and kind of position it is. You may do more like peer interviews, and that could be also over the phone or virtually. So I think right now with kind of the state of the state of the union with the pandemic is we're going to be working very virtually and over the phone. But I think that's it. So if you have any questions, I am here to answer.
Thank you for that wonderful and very thorough presentation, Julianne. We did have somebody join the session a little bit late, and they just asked what positions were available. I don't think you have to delve into, the details, so to speak, but maybe just, briefly mention them.
Sure, yes. We are actively looking for today patient care techs, which again are a lot of places may call them certified nursing assistant, CNA. Here at Vista, we call them patient care techs. We're also looking for ER techs, kind of equivalent to that CNA, but they are working in the ER. And both of those positions are full-time, part-time. We're looking for days and we're looking for night shifts as well. We're also looking for registered nurses and pretty much all of our units to work in the ER, to work in med-surg, to work in our tele or ICU units. I think the need for nurses right now is quite high. So those are our three top positions we're really actively recruiting right now.
Fantastic. Thank you, Julianne. And then another question that I just wanted to ask you, kind of given the fact that, you're hiring, from a healthcare standpoint, a lot of folks would probably wonder, what are the type of things or policies or measures in place that Vista Health has regarding COVID? Do you all provide PPE, maintain social distancing requirements, so on and so forth?
Yeah, absolutely. Great question. So being in healthcare, we're definitely, we are essential. We are all considered essential care workers. I'm considered an essential care workers. I have been working at the hospital since it started. We don't have any positions right now that would be working remotely. We are very, very much needed right now in the hospital. We do a great job with providing the proper PPE for our employees. And we are encouraged and talk about it every day that, to make sure you're wearing your masks, your goggles. Every different positions in the hospital will be required to wear more. Obviously, if you're a nurse in the ICU, you're in a gown, you're in goggles, you're in a face shield, you're in a mask, all that kind of stuff. But every single person that comes in this building wears a mask. We do get temperature checks. We have kind of a strict guideline in where you enter the building, whether you're an employee or you're a patient or you're a visitor. But everyone is required to wear the proper PPE, and we feel good about our quantities. We don't think that, right now we are not foreseeing any issues or anything. We maintain social distancing. We have maintained the social distancing through our orientation programs. We're continuing to do that. And, when you kind of go through these surges, just really making sure that we're cautious and adjusting to the pandemic and the areas and things like that. But we also realize that we are essential and that we can be exposed at any given time as well, just because we're working with patients. And you just never know, obviously, when someone's maybe potentially COVID positive. We do not have COVID-free units. So candidates have to be okay with working with COVID, positive patients and okay in that environment. So hopefully that answers that question.
Absolutely. Thank you, Julianne. And if anyone had any questions, regarding either employment for you or just general, application inquiries, where could they direct those to?
Yeah, I would really recommend you just email me. I think my email is probably provided somewhere, or maybe after this it will be provided. But email really works best. I'm more than happy to answer any questions. I would just ask maybe that, you just, introduce yourself and maybe, mention that this job fair that you were on and the virtual job fair and with Illinois WorkNet Center and go ahead and ask some questions and I respond pretty great with the email. It's Julianne_Nagel@quorumhealth.com. And I'm sure we'll provide that at the end here.
Fantastic. Thank you, Julianne. And I actually have included Julianne's email in the chat section.
Okay.
The next question that I did want to ask you is just generally speaking, how long does your hiring process take, from the point of submitting an application to the point of actually being hired?
Sure. Great question. I would say probably on average, probably close to 30 days. But I think that, depending on our needs, it also could depend on certain jobs, patient care techs, ER techs, registered nurse, when we really have critical needs to fill, we can do that as quickly as 2 weeks. But I would say on average, closer to 30 days.
Okay, fantastic. Thank you, Julianne.
Mhm.
And then another question that I have for you are just what are some of the opportunities for advancement? And then are there any sort of success stories that maybe you could highlight and that could perhaps even be your own?
Sure. Okay. So, I'm sorry, what was your first part of the question again?
Opportunities for advancement with your
Right.
organization?
Okay. Yeah. So opportunities for advancement. I think in healthcare, there's lots of different opportunities. As I kind of mentioned, a lot of people, are on their path maybe to be a physician or to be a registered nurse or maybe to be a nurse practitioner or a physician assistant or just different things, maybe a physical therapist or a respiratory therapist. With healthcare, I think there's a lot of things you can do along the way because sometimes the education and to get certified or licensed can sometimes take a while, but there's a lot of different positions I think that you can do within the hospital to kind of work towards that. And I think the PCTs and ER techs are a great example. Most of those positions ultimately want to become a nurse. However, ER techs, I would tell you, a lot of them really want to work in a fire department. They want to be a paramedic, things like that. So this is a great stepping stone for them to kind of work in the ER. A lot of my patient care techs would like to be nurses. And then there's a lot of other specialized techs that would like to start somewhere but be specialized, maybe working in a lab or be specialized working in more diagnostic kind of career path. And I think there's kind of different stages to each of those areas of healthcare. So I think there's a lot of room for growth. At the same time, a lot of that comes, with the individual wanting that, and sometimes it is the education paired with the working experience. So, a PCT, knows they have to go to school and finish nursing school before they're going to be a nurse. But there's always some great growth opportunities there, and we promote a lot within. We have a lot of nurses that go to they go to College Lake County Nursing School, or they go to DePaul, there's a master's program, or Chamberlain. There's lots of different ones, and they kind of work towards that. I recently just promoted a nursing manager who started here as a tech. and was working through going to College of Lake County in their nursing program, and then completed that. And we promoted him to become a nurse back, I think it was in 2017. And we just recently promoted him to a nursing manager. So I think that's been a great story to share and kind of watch him grow along the way. So I like that story. I've had a lot of um, recently nurses that have promoted to different kind of management positions. A lot of times with nursing, there might be coordinator kind of positions. It's kind of a stepping stone to a manager position. We have a few of them in those kind of positions. So there is lots of different potential, I think, at different levels, and most of it does require some sort of education to get certified or licensed, but there's the potential.
Fantastic. Thank you, Julianne. And at this point, I would just like to give you an opportunity to kind of make any sort of summary statements, or perhaps maybe include something that maybe you fail or you think that you might have, overlooked or failed to mention during your presentation. You can go ahead and do so now.
Okay. I feel like I talked a lot. Let's see. No, I think that, this is a great place to work. I've been here for a little over 4 years, and I've loved working with all my coworkers here. I think we have a lot of hardworking individuals that work at the hospital, and those that really want to do some good things here in the community and really help those in need in the community. And I think that's very special and exciting to see. I think especially as we had the COVID surge in the spring, it was really cool to kind of see how the hospital just really worked together as a team, and just worked very hard to protect and ensure our community was safe and do what we could do to help others. And I think we are entering those that surge again, and we're ready to be out there and help others. And I think if you want to be a part of that, we'd love to talk to you, and we'd love for you to apply. And we will hopefully I'll be able to connect with you.
And thank you so much for your presentation today, Julianne. I just want to thank everyone again for attending this virtual job fair. You can find Vista's employer booth on the Illinois workNet virtual job fair page. I also do want to mention that this session has been recorded, and it will be posted to the booth that you see on the screen there later today. Julianne, thank you again for your presentation. I hope you have a wonderful day.
Great. Thank you, Daniel. Thank you, everybody.
Thank you so much.